There are lots of folks who believe that pain as a fifth vital sign is one of the causes of this opioid epidemic, and there are some that believe that the HCAHPS scores for assessing your ability to treat pain in a hospital are also in part responsible for this. If you look at a lot of the data over time, that actually is not true. There's a lot of false information out there about some of these items. I think back, I was around when pain as the fifth vital sign came into being in the VA system, because I worked in the VA for many, many years. And if you think about the patients, how poorly their pain was treated, that was a problem. So again, we have a balance here. We have to decide, what's going to be best for the patient, not what suits us the best. One of the problems with patients coming to the hospital, if a hospital is graded on their ability to treat pain, and you've got substance abusers coming in, they know that, they're going to take advantage of that, right? So I think that what it boils down to is education. I don't think that healthcare providers or patients should be fearful about pain as the fifth vital sign or the scores that hospitals use in order for reimbursement structure. I think that we need to be familiar with these items, and we need to treat the patients as individuals, knowing that there are going to be patients that are going to need opioids, and there's going to be patients that should never receive opioids or receive as few opioids as possible. So I think it's being used as an excuse. It seems like everybody wants to point blame for the reasons why opioids are prescribed and opioids are this huge problem. The truth is, opioids have been a problem for centuries. It's always been a fine balance between treating pain and patients that abuse these drugs, or the black market for these drugs for centuries. This is not anything new. I think that now there's a keen eye on it, because previously substance abuse was thought to be something that happened in poor communities. And when you look at the more global picture, the people that have an issue with substance abuse, let's say in affluent communities or middle class communities, this has increased. We also know that substance abuse is a much higher prevalence in communities where there's depression, there's anxiety, there's loss of jobs, poor economy. All of these things have happened. All of these things have happened in the last 5 to 10 years. And so as the opioid abuse problem has increased, it's easy to blame it on one little silo. But the truth is, there are all these other socioeconomic things that are going on in the background that have been largely ignored. And so I think that if you look at the whole picture, really not a whole lot has changed. We've heard over and over again that prescription opioids are the gateway to teenagers becoming opioid addicts. That's not true. If you look at the SAMHSA data, you'll see that teens, the use of opioids has actually gone down. There are people that say, well, prescription opioids have increased. Well, prescription opioids have actually decreased. There are people that are saying, well, look, there's all this fentanyl now. That fentanyl is a prescription drug. All these people are dying of fentanyl. New Hampshire is the only state that has actually split out the fentanyl overdoses to see how much is really pharmaceutical-grade fentanyl and how much is carfentanil or another fentanyl derivative that's imported from China. And that has shown that greater than 90% of all fentanyl deaths were bootleg fentanyl, not the prescription drug. So there's a lot of rhetoric, I think, out in the community, in the press, and even among healthcare professionals and healthcare advocates that are sort of anti-opioid, that simply are not true. They're pulling out these sound bites and trying to make opioids the devil. The truth is, opioids are not the devil. They're really very helpful drugs. They're approved by the FDA for purposes that they are indicated for moderate, severe, or severe pain, and they're really very, very good drugs. But just like any other medication, they are dangerous if not used appropriately.